Hello and welcome to Talking Therapies. If you're watching this video, then you've referred to our service and you'll have your initial assessment booked. We're here to explain a bit more about what we do at Talking Therapies and to let you know what to expect as well. So, what does Talking Therapies do? Well, our service is made up of a team of clinicians who deliver talking therapies to treat common mental health problems such as depression, stress, general, social or health anxiety, obsessive compulsive disorder, post-traumatic stress disorder, and specific phobias too. You should have an initial appointment booked with us already. This is a 30 to 45 minute assessment to make sure we know how best to support you. This is a one-to-one appointment with one of our psychological wellbeing practitioners, or a PWP for short. Your PWP will introduce themselves, the service, and talk about confidentiality. They'll then ask you some questions and get you to complete some questionnaires. You'll also be able to talk through your current difficulties and what's brought you to Talking Therapies, plus discuss your goals for treatment. So have a think about what you hope to get out of treatment and what feeling better might look like to you. This initial appointment ensures we can get all the relevant information about how you're feeling and your symptoms, so we can make the right decision about the care you receive going forward. This helps determine whether Talking Therapies can support you with your current difficulties or whether we signpost you to another, more appropriate service. At the end of the appointment, your PWP will talk you through the next steps and possible treatment options, whether that's with us or a different service that's better suited to your needs. At Talking Therapies, we offer a range of proven treatment options, including guided self-help, group work, cognitive behavioural therapy and counselling too. All of these therapies are not simply talking about your problems, they are doing therapies. This means that you have an important role to play in the process as well as the therapist. Goal setting, working on in-between session tasks or homework is required for you to be fully engaged in the session. Your therapy appointments with Talking Therapies can take place either over the phone, through video conferencing, through typed text messaging now, or face-to-face, depending on what suits you best. However, there can sometimes be some limitations on both locations and times for face-to-face appointments. If you're looking for medication, screening or a diagnosis for more severe mental health disorders such as psychosis, personality disorders or bipolar disorder, we recommend you contact your GP in the first instance, who'll be able to refer you to a secondary services or a service better suited to your needs. When dealing with difficult life situations, it's quite common for people to experience distressing thoughts of self-harm or even suicide. If you're having these thoughts and feel at risk of acting on them, it's very important that you reach out for help. Talking Therapies doesn't offer a crisis support service, but there are a range of specialist services that can help.
You can call the R Crisis line on 0800 804 8999
or the Samaritans on 116 123. You can also text SHOUT to 85258 for crisis support via text message. You can also go to A&E. It's also common in times of difficulty for people to turn to or increase their dependence on alcohol or substances. While we do work with people who use low levels of alcohol and cannabis, or those who are stable on a treatment programme for other substances, you should be mindful that excessive dependency will interfere with the therapy process, and it's likely you'd first benefit from support from We Are With You, 01724 857 633, Narcotics Anonymous, 0300 999 1212, or Alcoholics Anonymous, 0800 917 7650. In the meantime, while you're waiting for your assessment appointment, you can visit our Talking Therapies website for a range of self-help guides and information that might be of some help at talkingtherapies.r-nhs.uk. Thank you.